Tell us a bit more about what's happening in Italy and the measures they've implemented there.
Well, it's definitely a drastic measure to try to curb the epidemic. It's 1/3 of the Italian population currently on lockdown. But to try to understand what's happening in Italy, of course, it's not easy. It's a complicated situation. But we can start by referring ourselves to what Italian Prime Minister Giuseppe Conte said a couple of days ago. And he actually hinted to some shortcomings in the way that they managed the crisis in the beginning. And it wasn't easy because coronavirus came to Europe through Italy. So they kind of got caught off guard. Now, what happened is that in the first place, every province tried to really do its own thing and manage the crisis as they could. And it's only later that they decided to have a more coordinated response to the crisis on a regional level. Now, right now, the main concern is whether the health system is robust enough to be able to cope with the influx of patients. Is there enough availability in intensive care to care for the most vulnerable affected patients? Now, I want to talk about a document that was published by a labor union, a health labor union called the CRT, and it says, I'm going to quote, "In units receiving infected patients, doctors have already been told to prioritize those who have the best chance of surviving." So this actually means that the health system is completely saturated, and a choice has to be made between those who have the most chances of surviving, which is a dreadful prospect. And this is why in France they've put in place, as at the end of February, what we call the White Plan for hospitals. And this means that you're asking all health facilities to, really map out their crisis management plan. They can increase the number of beds. They can cancel or reschedule surgeries. They can recall retired doctors, but also call upon students, med school students. So this is a really important plan because when you go into phase 3, this is what you want to avoid. You want to be able to take care of those patients that are in a critical condition.
Now, here in France, 19 deaths is the toll at the moment, and some, though, saying that France isn't doing enough to combat the spread of the virus.
That's right. Compared to what happened in China, they've been using confinement a lot, almost in a systematic manner. Also, what's happening in Italy now, Saudi Arabia also stopping to international flights coming in and closing schools. It's true that France, to some, seems to not be doing enough. The strategy of the government today is to say that they're staying in stage 2. They still want to focus on those clusters and dealing with those clusters with very specific measures. They don't want to do it on a national level. In France, we've decided not to diagnose people a lot, so we're not testing people a lot. The reason why is because this virus, we believe that a lot of people would test positive to the disease, so that means that they're carriers and that they can transmit it, but they don't have symptoms. So really, the strategy today for France is to focus on taking care of those who are the most vulnerable. That means elderly people, of course, but also people with pre-existing condition. And now there's one last thing that's important to note between Italy and France and how we both managed the crisis. In France, we were all advised to call the 911 emergency number, the 15 here in France, which gave it a more national way of dealing with the problem. And a lot of people say that the 15 did a really good job in sending those people, those first patients with those symptoms, to the right medical facilities.
All right. Thank you very much, Julia.